hot and cold therapy are some of the oldest recovery tools we've got. And quite frankly, I always get asked, what should I do? Should I ice or should I heat? So let's break it down into when to use what and what's actually going on in your body. Starting off with cryotherapy, also known as cold therapy. Cold therapy works by constricting blood vessels, decreasing nerve conduction velocity, and in turn decreasing the pain signal, which is why you have that temporary pain masking effect after about 10 to 15 minutes of use. Cold therapy has a great analgesic effect or a pain masking effect. When we think about tissue healing, we have to have a certain level of inflammation in order to stimulate that healing or tissue repair phase. And if we're trying to avoid inflammation, it's just going to stifle and prolong the amount of time it takes to recover. So technically, you could consider ice as an anti-inflammatory, but it's not the good kind of anti-inflammatory, nor is any anti-inflammatory. On the opposite end of that, we have heat therapy. Instead of constricting blood vessels, they're going to dilate blood vessels. It's going to improve circulation and it's going to increase nerve conduction velocity. In essence, this would have a performance enhancing effect, as the increase in nerve conduction velocity means a faster reaction time. In addition to that, if you're dealing with chronic pain, tension, or tightness, heat usually does the trick. I usually like to tell people ice for pain, heat for stiffness. Because if you're in pain, it's probably a fresher, acute type of trauma that is already inflamed. And if you heat something that's already inflamed, you're going to induce more inflammation, which isn't necessarily a good thing. On the contrary, if you're stiff, tight, or just feel some tension, heat is going to do a really good job at down regulating that tension, warming tissue up, and just getting things moving a little bit more freely. And drop a flame or a snowflake down in the comments below, and I'll send you my full cheat sheet. And follow for more science-backed, somatic-based tools to help you move and feel better.